Hello, everyone. Welcome to the International Myeloma Foundation's Living Well with Myeloma. This is our first Living Well with Myeloma webinar of the year, and this one is focusing on movement for myeloma patients and care partners. And just a little reminder, if you are new to the IMF, our mission is to improve the quality of life of myeloma patients while working towards prevention and a cure. And there we go. We're still having some technical issues with our slides. There we go. Okay. And our vision is beautiful. It's a world where every myeloma patient can live life to the fullest, unburdened by the disease. So March is Myeloma Action Month, and it's all about increasing awareness of multiple myeloma. We are doing that in many ways in lighting the world, in-person and virtual programs. We've got a patient and family seminar happening in Boca Raton, Florida this weekend. We also have a Facebook Live happening this weekend. And then Dr. Joe is going to be doing at Massey Comprehensive Cancer Center a Facts and Faith Fridays webinar, as well as we have a Los Angeles 5K happening. And we have another program with Dr. Sagar Lonial, who is a member of the IMF Scientific Advisory Board. He's going to be answering your questions on another Facebook Live program. And then we wrap up Myeloma Action Month at an in-person myeloma community workshop in Kansas City. This next slide, you can take a quick screenshot or a picture of this if you're interested. This is the entire 2026 year of in-person and virtual patient and family seminars, which are 2-day programs, and then the myeloma community workshops, which are 1-day programs. So we've got lots of good stuff happening for you. And now I get to talk to you about tonight's program and why you're here. So it's my pleasure to talk to you about our speaker, Dr. Karen Wonders. She's the founder and CEO of Maple Tree Cancer Alliance and a professor and program director of exercise physiology at Wright State University. Dr. Wonders is a passionate advocate for incorporating exercise as part of the national standard of care for people living with cancer. She's also an active researcher and has authored more than 700 peer-reviewed publications focused on exercise and cancer. So today, Dr. Wonders will share how safe, appropriate physical activity can help address common challenges such as fatigue, reduced strength, balance concerns, and overall quality of life during and after multiple myeloma therapies. She will also discuss practical evidence-based ways to incorporate movement into your daily life in a way that feels manageable and supportive. So our goal at the IMF with this program is to offer helpful guidance to support physical function, well-being, and of course, living well with myeloma. So as always, please remember that everyone's situation is different, and we encourage you to check with your own healthcare team before starting any new exercise or physical activity. We're very grateful to have Dr. Wonders join us today to share her expertise. And just before we get started, I have a couple of more slides so that you can participate and ask questions. You will see at the bottom of your screen this little box, and you click in there and you type that Q&A window, and then that's where you type in your questions, and you can type them at any time throughout the program, but we will hold questions after Dr. Wonders is through presenting. So she'll present for about a half an hour, and then you'll have plenty of time for Q&A. We also have closed captioning, so if you're having a hard time hearing or understanding our program tonight, you can click on that CC icon or show captions button in the control bar at the bottom of your screen. If you don't see it, click more, those three dots, and look for closed captions or show captions. So that could be, we've had great feedback from that you really enjoy the closed captions. Technical issues. If you're having any technical issues, send an email to meetings@myeloma.org, and Christina is going to be happy to help you. Feedback survey. We always feel it's so important for every single one of the programs that the International Myeloma does that we want to hear from you. We would really appreciate your taking the survey. So at the end of this meeting, you're going to have this little survey pop up. You can take it tonight if you want to. If you want to wait, you'll get an email shortly after the webinar tonight, and you could take it at your leisure, but sooner rather than later while everything is fresh in your mind. And then once the program is over, we do record this. The replay will be available on myeloma.org under that blue tab or the blue arrow that you see there under IMF videos. And you can go back and listen to it again. Or if you're a support group leader, maybe you want to play it for your support group members. So, of course, we are always very grateful to our sponsors, and tonight, educationally supporting this program are AbbVie, Sanofi, and Johnson and Johnson. So here it is, my absolute pleasure to turn it over to Dr. Wonders. Please take it away.
Sure. Well, thank you so much. Thank you for having me, and thank you for that introduction. It is an honor to be here today to talk with you all. Um, yeah, so I think you covered it all pretty well in my introduction, but I just kind of want to say I've been working in this field and conducting research in this field now since 2003. So 23 years it has been, and to see kind of the journey, the evolution of the field. When I first started doing research in this field, a lot of doctors were unaware of the benefits of exercise. They were telling their patients to rest and to avoid activity. And so to go from those recommendations to where we are today, when I believe soon, within the next couple of years at the most, exercise is going to be a part of the standard of care. And, patients everywhere are going to be asking about how to incorporate it into their lifestyle and what does that look like. And so I'm honored to be here today and talk with you about that. I hope to give you as much information as I can to make it very useful for you so that you can implement a lot of these things in your day-to-day lives. But please feel free to ask questions. I know we're going to have some time there at the end, and I'd love to answer your questions and, give you the resources that you can need to start an active lifestyle. So, again, today I'm going to talk about the role of exercise in patients who are, battling multiple myeloma. If you've survived, you're into recovery. So that's what we're going to talk about today. And my organization that I started is called Maple Tree Cancer Alliance. And I started this organization in honor of my grandfather, actually, back in 2011. Really, I had done this research. I had learned about the benefits of exercise and cancer when I was getting my PhD, but then watching my grandfather kind of go through his journey with cancer and talking to the doctors and realizing they didn't at the time anyway really know a lot of the benefits of exercise in a cancer population. And so it was really that encouraged me to start my organization, Maple Tree Cancer Alliance. And our mission is to improve the quality of lives of individuals who battle cancer, and we do that through exercise training. We have partnerships all over the country. Up to, I think, 34 countries around the world right now, which is very unique. I never thought, when I started this 15 years ago, that you know, it would bloom to that. And I say bloom, no pun intended. I'm talking, maple tree bloom. But, just to see the way that exercise has been embraced throughout the globe, It's just really encouraging, and hopefully that kind of helps you to feel like, okay, this is a well-researched area. There's a lot of literature. We'll talk about some of that today to support these things that we're talking about. And so, if you have concerns or some fears about starting an exercise program, hopefully that might put your mind at least a little bit at ease. So when I say the word exercise oncology, all that I'm talking about there is just the use of physical activity and exercise to enhance the lives of people with cancer and cancer survivors. So essentially, any kind of physical activity that starts at the time of diagnosis and then progresses on through the rest of your life, whether you're still in active treatment, whether you're in long-term follow-up care, whether you're in complete remission from your cancer, anyone from the time of diagnosis forward, anyone that participates in exercise, it's called exercise oncology. And there's unique aspects to that we'll talk about today. So, as I mentioned, I personally have been doing research in this field since 2003. So, you can kind of see here this little timeline. You can see I entered about halfway through the whole big picture of exercise oncology. But what's really unique is when I was getting my PhD, my advisor in my program was diagnosed with cervical cancer and was undergoing treatment for that. Oh, we're still going to be here. Yeah. So she was undergoing treatment for cervical cancer and was going through the different side effects and things that she was experiencing. And they really weren't too terrible initially, but the one thing that was really bothering her was she had weakness in her hands. And that became really difficult for her because she lived alone. And, you might not think hand weakness, you might think, oh, well, at least she's not nauseous and sick and, all the other things. But for her, she wasn't able to open jars by herself. She wasn't able to cut, vegetables or meat. It really impaired her ability to be able to cook for herself. And she lived alone, which meant she's eating out at a fast food restaurant 5, 6 times a week, which is not the ideal diet that you want to have whenever you are undergoing cancer treatment. And so she was one of the first people in the country to study exercise and the effects of exercise on cancer. We're still here on this slide here. Um, and so you can see here in the early 90s, that was when she started her lab and began doing research on the effects of exercise and studied herself first and then, was able to grow into other cancer patients. But really, you can see since then, there's been a dramatic increase in the number of publications in this field. So since 2014, there have been at least 1,000 publications a year, researched, evidence-based, peer-reviewed journal articles that show the benefit of exercise in a cancer population and how this can help them. So this research right here is really what is helping to propel this field forward into conversations like we're having tonight because the research there is so strong. Right now, today, there's about 33,000 published articles in research articles that support the role that exercise can play in a cancer population. Some of the documented benefits of exercise include these. These are listed right here, and this is based on all of the available literature. It's been kind of condensed into these 8 things. However, the list does go beyond these 8 that we're going to talk about today, as I'll go through as we talk about the multiple myeloma and exercise specifically for this cancer group. But you can see, there are numerous benefits here that really do have such an impact on your quality of life. And so what we find is patients who exercise during cancer treatment. So it's okay to do this during chemotherapy. It's okay to do this during radiation, anything that you're going through, we just adapt it for you. But it does help significantly improve your fatigue, your sleep, quality of life, anxiety, depression, body composition, your physical functions, so like your ability to go up and down stairs, your ability to sit and stand without much assistance, that sort of thing. And then also breast cancer related lymphedema. And I will say that the majority of this research has been conducted in a breast cancer population. But that is to say, this extends to all patients here. So a lot of times you'll see related to breast cancer, like on this list. That's just because that's the largest group of research that exists today. We are working to get other cancer types involved. We actually just got a grant last year to work in pediatric cancers. So, you know, this does extend to all cancer survivors. And I do want to say, I see the questions coming in. We are going to answer those at the end, but I just saw what is PA on this chart? PA stands for physical activity. So physical activity and exercise are used interchangeably here in this case. The other ones I will do my best to answer at the end. Sometimes I get ADHD, and so I get distracted if I spend too much time looking at the questions, but we'll do our best to answer at the end. So specifically as it relates to patients with multiple myeloma, here's really where we can see some true tangible benefits of exercise. So first, we see improved physical function. So that relates to your mobility, your abilities to go through your activities of daily living. So again, walking up and down stairs, getting in and out of bed on your own, getting up and down off of a chair by yourself, those things we see an improvement in. And that's because you're strengthening the muscles, especially in your lower body, but in your core as well, that are helped to stabilize you. And if you're experiencing any kind of bone pain or weakness, regular exercise will really help to strengthen those muscles around it, and it'll provide more support for your bones, and that will help to mitigate some of that weakness that is developing. So we see that fatigue reduction, fatigue across the board can so significantly impact a lot of patients who are undergoing cancer treatments. And exercise, it doesn't feel like that would be number one on your list whenever you're experiencing that overwhelming whole body fatigue that patients can experience, but it actually is. It's like the number one non-pharmacological agent that can help reduce fatigue. And I'll tell you just a quick story about my grandfather. My grandfather was diagnosed with colon cancer in 2007, and it was a very aggressive illness. From diagnosis to death was about 5 weeks. So very, very aggressive, um, and really impacted his quality of life. Very, very, as soon as he was diagnosed, basically his quality of life just really went downhill. And one of the first times that I saw him after his diagnosis, I'll never forget, he was sitting in a chair in his living room, and my grandmother was feeding him scrambled eggs. And when I walked in the room, he looked at me and he said, "You have no idea how exhausting it is just eating these eggs." And, I think that was the first time for me that I ever really saw fatigue qualified in that way, cancer-related fatigue, and just how overwhelming it can be just simply eating scrambled eggs that someone is feeding you, that becomes difficult. And so you can see those implications. You're too tired to eat, you're going to stop eating, and what is that going to do to your overall health status? And so it can really significantly impair your quality of life. And even my grandfather, even in his final days, it's not like we could get him up out of bed and take him to the gym. I mean, that would not be feasible. But what we decided to do was every hour on the hour, as long as he was able to, we would get him up out of bed and we would walk one lap around the downstairs of his house. And then we would put him back to bed. And that's all that we would do. But just even doing that helped boost his energy level, and it improved his mood. And he started eating again as a result. And I really do believe, now he's a different case. He was, at the end of his life, but even then it was impactful, and it had a positive result, even in his final days. And so it may feel like it's the last thing you want to do, but just sometimes simply moving your body, walking around the downstairs of your house, walking to the mailbox and back, just doing something really, really small can have tangible increases in your energy levels. So, we'll talk more about that as we go through, but I did want to share that story with you because that really impacted me and made me look differently at this. Another benefit that we oftentimes see with exercise in patients with multiple myeloma is a bone health maintenance. And so, if you're doing weight bearing exercises means more like you're supporting your body weight. So, not necessarily with dumbbells or resistance bands or anything like that, but just by walking around, you're supporting your body weight. That's a weight bearing exercise that can help further prevent bone loss, which oftentimes is a significant problem for patients with multiple myeloma. And so that can kind of help slow that process. We also see an improvement in cardiovascular health. The benefits of exercise on cardiovascular health, whether you have cancer or not, are very, very well established. We know that aerobic exercise improves heart health and helps manage your overall risk factors, such as high blood pressures or anything like that. There's numerous benefits to aerobic exercise in particular on your cardiovascular health. And then finally, physical activity can positively impact your mood. It can reduce stress. I know I mentioned a little bit about my grandfather and how it, helped to impact his mood. Really, what I think sometimes happens is this was something that he could control. He couldn't control that he had cancer. He couldn't control that it was impacting him the way that it did, but he could control making that decision that when that timer went off and it's time to do an exercise bout, he could control that. And that really did help with his anxiety levels that he was experiencing, the stress that he was experiencing. So you can see definitely very positive impacts on your overall well-being. So, what counts as exercise? Exercise looks different for everybody. And one of the things that I really promote through Maple Tree, through my organization, is it's individualized, it's individual to you. And so, with every patient that we serve, we do a fitness assessment on them. We see what their starting point is, and then we build the exercise program from there. And so, exercise, it can be intense, but it doesn't have to be intense. And the beauty of meeting someone where they are is understanding what their limits are and then not pushing them too far. And so, exercises that can really help support recovery can be as simple as taking a walk around your neighborhood. So oftentimes neighbors or friends or loved ones want to know, what can I do to help you? Well, how can I support you? Here's a casserole. Here's another casserole. Well, one of the things you can say is, why don't you come over to my house at 7 p.m. and we'll take a walk around my neighborhood? And something like that is social. And also it helps, give you some accountability. It kind of helps kind of force you sometimes out the door when maybe you might be tempted to sit and not take a walk that day. So it's a really good thing. Actually, before I'm on the East Coast time, so before I jumped on to do this webinar, I was walking with a friend of mine. I have a neighbor across the street who is battling breast cancer. So I walk with her to get her out of the house and moving. So walking around your neighborhood is a great activity. Sometimes even light household activities can count as exercise. I always count my laundry as exercise. This is not included in my bio, but I have 7 children, and so I do a lot of laundry and a lot of cooking and cleaning after them. And sometimes when I'm doing my laundry, I'll throw a couple of squats in there just to get my activity levels up. But those all count as exercise, particularly if you're going up and down stairs, you're carrying laundry baskets or groceries or whatever. That all counts. Chair exercises are also really great, particularly if I see a couple of people in here talking about peripheral neuropathy. So especially if you do have issues with balance and you can't maybe feel your extremities, then definitely what I would recommend is doing chair exercises. There's all kinds of exercises that you can do seated. You can do stretching seated. You can stand behind the chair if you're able to and hold on to the chair for support while you're doing even standing exercises. So that's a great way to get started. Gentle stretching oftentimes can be a great way not only to help your muscles to feel better, but also to help relieve fatigue that you might be experiencing. And then, of course, water walking and pool exercises are really great, particularly if you're prone to falling, with the peripheral neuropathy. But then it also is a great exercise to do because it does take away some of the weight bearing. And it might be a little bit easier on your joints. If you find that you have painful joints, then that might be a great thing. And so keep in mind that short periods of movement throughout the day are just as beneficial as one extended period. And so if you feel that you are suffering from fatigue and you just cannot possibly do 30 minutes straight of exercise, doing 10 minutes and then taking a break, coming back later and doing a 5-minute burst of activity, that all counts. And that still goes towards your daily allotment. And so don't be afraid to split it up throughout your day based on your time that you have, your energy levels that you have, and kind of how you're feeling for that day. Those are all things that you can do. We really do like to recommend low impact cardiovascular activities, particularly if you are in the middle of treatment. That can really help to preserve your immune function. It helps to delay, it helps to kind of offset any dose delays or dose reductions that you can have. We actually published a study a couple years ago looking at dose delays and dose reductions with exercise. And we found that low impact, low intensity cardiovascular exercise is a really good starting point for that. And so essentially what you want to do is walk. You can start with 5 or 10 minutes and then gradually increase from there. If you're worried about falls or peripheral neuropathy is a concern, you can try stationary biking. Recumbent bikes are a great way to get in some low and impact exercises for you. And then, of course, swimming or water exercises are also very beneficial as well. When it comes to strength training, now for the most part, this is fine to engage in. What I would recommend though is, definitely talk with your physician before starting any kind of exercise program, whether it's aerobic exercise only, whether it's resistance and aerobic exercise. It is, for most people, it is okay for them to do resistance training, strength training exercises. But again, there might be some conditions that I don't know about that you may have. So you would want to talk to your physician about that. But for the most part, people can engage in modified strength training exercises. You can use resistance bands. I wish I had one with me. If you're familiar with them, they're just like really big, stretchy rubber bands, and different colors are different levels of intensity. So you can get a green one, which is a little bit less intensity, a little bit easier to pull apart. You can get a red one, which is just a little bit more difficult. And then the black one is the one that I try to stay away from because that's really hard to pull apart. That's my son's favorite. He's a baseball player. So, I would recommend starting with resistance bands and then progressing up to free weights. And again, you can do seated exercises to help with your stability. And you would want to focus on controlled, smooth movements when you're doing your exercises. And we'll talk a little bit about posture and kind of what that looks like. My recommendation would be, again, after physician clearance, would be to start with 2 or 3 exercises and learn how to do those well with proper form without any pain and do about 8 to 12 repetitions of that. So when I say repetitions, I mean, 1 repetition, 2 repetition, 3 repetitions. So however many times you do it in a row. You want to go for about 8 to 12 repetitions. If you can do more than that without any real strain, then probably you're at a place where you can try maybe a little bit more resistance. If you get though to 8 and you're like, I couldn't do another one that was very hard, or you're feeling any pain, then you probably want to back off a little bit, lower the intensity just a little bit. And, you want to be able to hit that window pretty, I don't want to say easily, but without pain, without added strain. And then you also should incorporate some balance and flexibility exercises. So gentle stretching within a pain-free range. You probably will feel a pull on your muscles whenever you stretch. That is normal, but you should not feel any pain. So if you stretch to the point where you feel a gentle pull, hold that there for about 10, 20, 30 seconds or so, but never to a point of pain, never to bounce into that stretch. You want to just do nice, slow, and controlled motions. If you're unable to get up and down off of the ground with any ease, you can stretch seated in a chair. There's definitely even balance exercises you can do in a chair, standing behind a chair, holding on to it. Those are all possibilities for you. When you're stretching, really try to focus on maintaining your daily function. So that could mean something like if you feel tightness in your upper body, well, that's going to impact your daily function because you have to reach to get a glass out of the cupboard to drink some water. You've got to, if you want to wash your head, you need to be able to put your hands up overhead. So you want to stretch then to help improve your upper body range of motion. Same thing for lower body. If you feel tightness in your lower body and that's impeding your activities of daily living, then you want to do some stretching, some balance exercises there. And then, when we're talking about just the benefits of these exercise, I feel like we've already kind of touched on this. I'm sorry if you can hear meowing. My cat just came in the room. And my husband, of course, is not here to come get him. So if he continues, I might have to go let him out. He's like a barn cat that comes in and out. So my apologies if you hear him meowing. So yes, again, just to touch on some of the benefits for exercise, it helps manage your cancer-related fatigue. It does help support bone health. It improves your mood, reduces stress, and helps you to maintain those activities of daily living. So when you're doing these exercises, particularly if you do have issues with bone weakness or bone health that you really want to take care of, and I apologize, this font is very small, so I hopefully you can read that. I know I'm having a hard time reading that. But you do want to make sure that you're practicing good posture in all of your exercises that you do. So you can kind of see here straight back versus curved back. You want to make sure that you are using good posture. Not only will that help with your form, but it will help reduce the possibility of injury. And it also helps you to breathe better while you're undergoing and doing the exercises. When you're hunched over, it actually impairs your ability to really take big, deep breaths in, and that can negatively impact your exercise response. So I'm going to try to walk and let my cat out at the same time. Okay, so the 5 minute rule for when it comes to getting started with exercise. I always kind of talk about this 5 minute rule. And basically, what this means is on a bad day, when you might be feeling like, oh, I know I should go exercise, I just don't know if I have it in me, or I don't know if I really feel like it today. What I say is give yourself 5 minutes. That's just a walk to the mailbox, a walk around your block. I mean, just try with 5 minutes of activity and even set a timer if you want. And when that 5 minutes is over, just kind of assess yourself, see how you're feeling. Because most of the time, what we find is that after just 5 minutes of activity, people do start to see a boost in their energy levels. And sometimes they feel like, okay, I can go five more. So let's do 5 more minutes. And if that's the case, then, continue on, but continuing to give yourself permission to stop and assess how you're feeling. If you're not feeling better, if you're just like, you know what, I just don't have it in me today, give yourself permission then to stop and to rest. Listen to your body and what it's trying to tell you. But many people will find that gentle movement actually does help to reduce your fatigue. So, give 5 minutes a try and see how you feel. And something that I do like to talk about is the difference between cancer-related fatigue and exercise, and yes, and exercise-related fatigue, because they're very different. I explained about my grandfather and the fatigue that he felt. His fatigue was so overwhelming, he had a hard time eating scrambled eggs that was being fed to him. So that is, persistent, overwhelming fatigue, and it will need some careful management. We can also get exercise fatigue as well. And typically, this kind of fatigue is temporary and it improves with rest. And so when you're experiencing the fatigue, kind of take stock on that. Is this, if I rest, do I start to feel better, or do I continue to feel this overwhelming sense of fatigue? And that's how you can kind of gauge how hard you should push yourself. I mean, if you're experiencing fatigue, you do want to back off a little bit, but you can kind of use that as your guide. Is this exercise related fatigue, or is this something that I really need to manage and to, look deeper into? So, when it comes to managing fatigue in patients with multiple myeloma, these are just some tips that are research based that might help you. So, one of the things that you can do is time workouts when your energy levels are the highest. For some people, that'll be in the morning. For some people, that'll be in the evening. There is no right or wrong answer to this. I was always someone who preferred to work out in the evening, and my husband, who is a morning person, thought I was crazy, but that's when I had my most energy. And so, depending on the time of day that you feel the best, that's when you want to do the exercises. Again, you want to start small, start with 5 or 10 minutes, especially if you're new to exercise. Be sure to rest in between the exercises. Make sure you're paying attention to hydration. I always have a big water bottle by my side just so I can stay hydrated. So, make sure you're staying hydrated. That will help reduce fatigue levels. And then I also think it's helpful to track your fatigue levels and, kind of take track on not only from day to day as it fluctuates, but even within the day. And sometimes what I'll try to do, especially if I'm experiencing fatigue, is I'll try to kind of match my fatigue levels with things like, how did I sleep the night before? What has my diet been like? What have I done earlier this day? And look for patterns that might come up that can help you to manage your fatigue, in ways other than just simply adding exercise. So I'm a researcher. I like to pay attention to things like that, but it might help you to identify some patterns there. Another thing we want to be really careful about is fall prevention. And so, with multiple myeloma, oftentimes you do see an increase in the risk of falls, and this can be due to bone weakness, to fatigue, to neuropathy. And so, it's just really important to exercise some safety strategies when you're exercising. So, look for well lit areas. When I go on walks, oftentimes with patients, I will just make sure that if the surface is uneven, I'll at least alert them to that. Sometimes we'll walk on sidewalks and the roots grow into the sidewalk. So you see these bumps, and you want to pay attention to things like that because that can be a tripping hazard, very, very easily, really without warning sometimes. You want to make sure that you're wearing supportive, non-slip shoes. It's okay to use a stable support like a chair or a wall, or if you're walking on a treadmill, holding on to those handrails, that is absolutely okay. Sometimes things that we don't think about, like a loose rug, can even make us fall, or an obstacle on the floor. If you have grandchildren or your children of your own or pets with their toys, sometimes, it's very easy to trip on those, especially if you're in a place like your house where you are accustomed to the layout and you're probably not really looking down, watching the floor as you're walking. Obviously, uneven or slippery surfaces. I live in Ohio, and so we have to be very careful about this in the winter time when, there's black ice or snow on the ground. You always want to be careful about that. And then stop if you feel dizzy. And so that's where we recommend always paying attention to how you feel and stopping if something doesn't feel quite right. And so, I wanted to get into kind of what is happening inside of the body, how exercise is helping to support the bone health. And so what we find with exercise is that it stimulates the bone forming cells in your body. So it can actually stimulate bone growth, making your bones stronger. It can also help improve balance and help prevent falls through strengthening the bones, but then also strengthening the muscles that protect those bones and by protecting joint health. So that's kind of what is happening. happening there. When it comes to exercise selection, again, weight-bearing exercise as appropriate is fine if you've been cleared by a physician. Resistance training exercises with the bands that we talked about. Pool exercises are really great for helping to reduce your impact. And then, of course, taking steps to mitigate falls. So before you start, there are things that you want to talk to your doctor about, such as, if you have any active bone lesions or recent fractures, you definitely want to talk to your doctor before starting an exercise program. Anemia, fatigue, that's going to limit your activity, any uncontrolled pain or recent surgery or balance problems, you would want to get some clearance from your physician before engaging in an exercise program. And a lot of times, what the physicians will do is they'll just give you guidance on, yes, you can exercise, but avoid lifting weights past this amount, or avoid letting your heart rate go past this number. And, that kind of gives you the guardrails to stay in, but it also helps if you're working with an exercise professional to help, keep them in the guardrails as well, that they're not going to be doing anything that's going to cause harm to you either. And so, if you are thinking about starting an exercise program, I just wanted to put together here what a sample program might look like, something that you might want to consider working up to you. If you want to screenshot this and refer to it later, you're more than welcome to. But I just kind of put together Monday, we're going to do a 10-minute walk and we're going to do gentle stretching. So, in total, we're talking 15, 20 minutes complete, and then you're done. For Tuesday, we would do just some chair-based stretching exercises. So again, with your resistance band, focusing on major muscle groups. So, maybe a chest press exercise, overhead press if you can, something with your lower body like sit to stand, standing up, sitting back down would be beneficial. But just some chair strengthening exercises. Wednesday, you can take as a rest day if you'd like, or maybe do some light activity, maybe some gentle housework, something like that would be great. Thursday, we're going to try for a 10 to 15-minute walk. You can do some stretching exercises before and after if you would like. And then Friday would be another resistance band session. So that is what a typical program would look like. Now, ultimately, you would want to increase those times if you could, ideally working up to about 30 minutes a day if possible. On 3 days a week would be probably minimum that we would want to do there. But again, that is a goal that you can work up to as you're able to. With intensity and duration, a lot of times people will ask, well, how hard should I work? How do I know if I'm working hard enough? What I usually will say is use the talk test. So if you can talk and carry on a conversation, probably you're at a good intensity level. You might not be talking the way that I am right now. You might have to, you're probably going to be aware of your breathing while you're exercising, but you should still be able to talk. If you're to the point where you cannot talk, you cannot get a word out, that means you're exercising too hard. You want to bring it back. And then allow yourself to progress slowly and as you're able. So again, listening to your body, monitor the exercise as you see your exercise response. So if you're feeling fatigued, if you're feeling dizzy, definitely back that off. But if you're having a day when you feel good and you do 15 minutes and you're like, I could probably go for another 5 more minutes, give yourself permission to do that as well. But pay attention to your body and listen to what it's telling you. With safety considerations, you do want to avoid, for the most part, you want to avoid high impact activities like jumping or sprinting or anything like that, just because of the bone weakness. You don't want to, put yourself at risk for fracture or for fall. Definitely monitor for side effects. And then, of course, avoid infection risk. So if you are exercising at a gym, I think I saw a YMCA question over here. Generally, those are pretty safe and pretty clean, but I don't think there's anything wrong with wiping down the equipment before you use it and wiping down the equipment whenever you're done. Just because who knows if the person before you has done the same thing or not. And if you are exercising, be kind and wipe it down afterwards. But, taking those simple infection control risks can help kind of keep you healthy, keep you on your treatment schedule. And then just some practical applications I like to recommend, especially if you are brand new to exercise. Practice specific movements that are needed in your daily life. So, again, if you have a house with stairs in it and you have to go up and down those stairs every day, you should be doing exercises to strengthen your lower body so that you can go up and down those stairs. Making sure that even in daily tasks that you're using proper form. So if you're unloading the dishwasher, you know, have good form when you do that. Don't throw your back out while doing, while getting up and down to get the silverware out. So, try to match that and try to watch the form with which that you do these activities. Feel free to modify activities based on how you feel during that day and know when to ask for assistance. And so, finding an exercise professional who is educated and certified in this area is great. Talking to your doctor about it is another really good conversation to have. But, don't be afraid to ask for help or ask questions when they come. And then the last thing that I wanted to share here is just ways for you to stay connected with us. So, Maple Tree Cancer Alliance, if you want to follow us on social media, that QR code will take you there. We have some educational resources available on our website completely for free for you. So, feel free to check those out. And then finally, we just created this. It's a guide for newly diagnosed patients. So if you are newly diagnosed and you really just don't know where to begin when it comes to exercise, this guide is meant for you. So just from the very beginning, a lot of what we talked about here today in terms of the evidence base that's out there and exercise recommendations and how you can get started, all of that is available to you. So please feel free to check that out. And I see a lot of questions. I know, Robin, you'll just feed them to me. Is that what you want to do?
Yeah, and I wanted to thank you because you've been a dynamo at presenting, and at the same time, you are looking at these questions in here. You've consolidated some nicely. We really had a lot on peripheral neuropathy. We had them on balance and motivation, and you talked about the buddy system and walking with your neighbor. There's a couple of them, and lots are coming in. But one I thought particularly important for future reference is you mentioned partnerships, and how would you find a facility nearby?
Oh, that's a great question. And so right now, we all of our sites are listed on our website. And so we've got, I think, about 60 different hospitals that we're working with, and then, different community-based fitness centers and physical therapy groups. So all of those are listed there. If we're partnered with a hospital, we work it out with them so they cover the cost for the patients to go through that program. And so there's no cost there to patients who are, patients at those particular hospitals. This is not a service that's covered by insurance yet. And so we have to raise the money to do that by grants and by different things like that. So if you luck out and you're at one of those hospitals, then absolutely, you can contact us through our website. We can get you started. If you're not near a hospital, but you want to talk with a trainer, we do have self-pay options available. And we really do try to make those very doable for patients. I mean, that's why I try as much as I can to offer it for free, just because I know that I think I saw a stat that the average cancer patient, their monthly income, expenses increases by about $800 a month. And so we never want to add any burden to that. I never want finances to be something that stands in the way of healthy lifestyles. So hopefully we can help you with all of that.
Yeah, that's great. And there are additional questions coming in about YouTube. You can find
Mhm.
things online, and what are some safe recommendations, as well as people asking about things like yoga and Tai Chi and those type of classes.
Yes. And so one of the things that we are seeing with this, huge momentum in the field of exercise oncology right now is there are a lot of resources available online and different, fitness centers, YMCA's, community-based fitness centers are starting to incorporate more cancer specific programming. And so I would just say as a whole, do your homework. on that. If there is a cancer specific exercise class, it's okay to ask what kind of training or credentialing the trainer has gone through in order to teach that class. I know, there are different certifications out there. Mapletree has a certification that we use for our trainers, so they all have at least a bachelor's degree plus this certification, but you want to make sure that they have some kind of training in this area. With yoga, sometimes there are going to be some poses that would be contraindicated. So you would want to talk with your physician about that. Like, for example, I would ask, like, is it okay to do any weight bearing exercises on my arms? So something like downward dog. Your physician may not want you to do that. And so I think that's a good conversation to have. Usually Tai Chi is pretty good. I mean, I don't see any harm in that other than just making sure it's an area where you won't fall. But that is good. Same thing with YouTube. There are a lot of exercise videos on there. Again, I personally would just say do your homework on the person that's presenting, make sure they know what they're talking about and they're, you know, doing things that are safe because anyone can say anything on the internet, and you just want to make sure that you're protecting your safety.
Absolutely. Beware, right? We have
Yes.
to, pay attention, be careful ourselves. If it seems too good to be true, it's probably not true, right?
Right. Yes, yes, exactly. But, I think it is really important to engage in activities that you do find enjoyment in. So if you hate to bike ride, pick a different exercise. You want to pick something that you enjoy because, ideally, you would enjoy exercise. This would be a highlight of your day. We don't want it to be something that you dread doing. But if you pick exercises that you hate to do, you probably will dread doing it. So if you love Tai Chi, if you love yoga, if you love taking walks, then those are the exercises that you should do. I would just recommend talking to your physician and making sure you're aware of any boundaries that you need to keep. But otherwise, that would be my recommendation.
Yeah, absolutely. So important. I see someone here saying that they love line dancing and does it qualify as low impact and salsa?
Yes.
That sounds like something fun, right?
Absolutely. And sometimes I'll try to do one of the TikTok dances with my daughters, and I count that as exercise because sometimes that can be pretty strenuous as well.
Yeah.
Qigong, same thing. All of these are great. They're all very good. It really is about finding what you enjoy and what you're going to stick to. And the motto that I always use is something is always going to be better than nothing. And so finding what you like and doing it, even if it's 5 minutes, even if it's one lap around the downstairs of your house, that is better than nothing. So always keep that in mind.
I love it. And it reminds me of a question that we had way early on in the beginning. It might have been like question number one or two, but it's an important question about monitoring your pulse rate. Can you talk a little bit about that?
Yeah, I think that that is a very good question. And so, monitoring your heart rate is one of the ways that we determine exercise intensity. And so, we all have a heart rate at rest and we all have a maximum heart rate. And your maximum heart rate is age related. So, it's a very simple equation 220 minus your age. So, for someone who's 20 years old, their maximum heart rate would be 200. 220 minus 20 is 200. For someone who's 40, it would be 180. So you can see as you age, your maximum heart rate decreases, and that's an age-related decrease. Now, generally, we don't want to exercise at our max. And anyone who has ever exercised at their max knows that it's not very fun and it's not very easy to sustain for a long period of time. So, what you want to do is exercise in a percentage of your max. And usually, for patients, as you're going through cancer treatment, and again, this is going to be more individualized and specific based on what you can tolerate, but about 40 to 60% of your heart rate max is where you want to be when you're exercising. And so you can do that calculation on your own and then kind of monitor it. I know I have an Apple Watch and it will tell me what my heart rate is when I'm exercising. The one thing though that I want to kind of point out is that sometimes people can be on like a blood pressure medication, or there are some medications that will blunt the heart rate. And so perhaps your maximum heart rate is 180, but you're on a blood pressure medication or a different type of medication that blunts your heart rate, and it will not allow your heart rate to go above 120, maybe, for example. In that instance, you cannot use heart rate to monitor your intensity. So you would want to go off of, I would just ask yourself on a scale of 1 to 10, how hard do you feel? Probably you want to be between a 4 and a 6. And that would correspond to the 40 and 60% that we talked about. So if you ask yourself that and you're at an 8, you want to cool it down. If you're at a 2, you can maybe bring up the intensity a little bit more.
Well, I have to say, time goes too fast when you're learning good things and having fun. I think that part of learning from you is that we can all go out and have safe fun. Again, talking to our own healthcare team, making sure that we're doing all the right things. That last question was so well stated and taking into consideration not only age, but what type of medications you may be on. So
Mhm.
I just feel like this was a wealth of knowledge and sharing your expertise. So all of our myeloma community understand better, as well as their care partners. We want our care partners to get out there and to feel good and to go to all their doctor appointments and get their exercise as well, right?
Yes, absolutely. And it's a great way for accountability to have a buddy to do that with. So absolutely. And to be a caregiver is so stressful. And this can be something that can really help manage your stress. So 1000%, yes, I would encourage that.
Oh, I wish we could keep you on for a whole second hour. We'll have to figure out how to get you back again because time is now at the top of the hour, and we're so grateful again that you came in. We know we didn't get to every single question out there, but I would encourage everyone to not only replay this video, but don't forget to, let's see, the slides are not advancing for me again. Can someone please advance the slide? Oh, too far back a couple. So I want to, if we go back to Milo, yeah, I want to remind everyone that on the IMF's website, we have Milo, and Milo is a safe chat bot. It is limited to the information that is available on the IMF website. So you're not getting things that are inaccurate, out of date. And so this is a good place if you have additional questions, as well as the IMF's info line. So many of you have called in to Paul and Missy, and you've gotten the wisdom from them and Dr. Joe with their resources and information for you. And so you could see the phone number there to give them a call or schedule a time that works well for you to talk with them and ask them more about the questions that you have so you can live well. I'm just going to quickly remind you about that feedback survey. Again, as soon as you hang up, you're going to get a little pop-up, and then you'll also get an email from us. We really appreciate, we read every single piece of information and feedback that you give to us and try to make better programs all the time. What are your unmet needs? What would you like us to bring to you next time? Because we will have another Living Well webinar in the fall. We do two every year. And again, last little reminder, we are going to have the replay of this as well as the slides. I saw a few questions on this. Where can I replay this amazing webinar again? So you go to myeloma.org, you click underneath publications and videos, and then you click on videos. And this is a Living Well with Myeloma video. So you would click right there to get the replay of tonight, as well as so many other really informative, resourceful webinars that we've had in the past. And as always, it's my pleasure to thank AbbVie, Sanofi, and Johnson and Johnson. But most importantly, Dr. Wonders, you've really given us hope. You've given us good things to get out in the spring and get outside and get moving and doing and talking with our healthcare professionals. And for everyone out there, We wish you well and continue to learn and be empowered and ask your good questions. So thanks to everyone and have a wonderful evening.
Bye. Thank you. Thanks for having me.